Alright, so my name is Josh Moore, and I am doing my research paper on attention deficit hyperactivity disorder. Um, but first, let's talk about what ADHD actually is. It's classified as a behavioral disorder. The reason that it is called a behavioral disorder instead of like a psychological disorder is um, it manifests itself in the behavior of those affected by ADHD, such as hyperactivity, inability to concentrate, things like that. It definitely affects children more often than adults. However, that is kind of changing nowadays as um, diet, adults are becoming more and more diagnosed with adult ADHD as well. Um, it manifests in learning challenges. Often children have a hard time sitting still in class and learning. Organizational challenges. It makes it difficult to organize tasks, things like that. Impulsivity. Often people with ADHD have struggled with impulse control. It was discovered in 1798 by a Scottish doctor by the name of Sir Alexander Crichton. He noticed that some people were easily distracted and unable to focus on their activities the way that others could. He reported these symptoms began early in life, and that is consistent with how we now call attention deficit hyperactivity disorder. Um, it is more prevalent today than it used to be in the past, but that has a lot more to do with our understanding of the disease and an increased ability to diagnose it as well. Our goals in this presentation will be: how does ADHD affect the brain? What are its symptoms and how do they affect the patient? What causes these symptoms and how are they treated? How is ADHD diagnosed and what treatments are available and how do they work? Um, the ADHD is a brain disorder. Research has shown that some structures in the brain in children with ADHD could be smaller than those areas of the brain in children without ADHD, and primarily in the frontal lobe. The causes of ADHD. So the risk factors are unknown currently. There's strong evidence that it is linked to genetics, which means it's passed down from parent to child. The current research that we're looking at to kind of understand if there could be a risk factor attributed with brain injuries, exposure to environmental risks such as lead during pregnancy at a young age, alcohol or tobacco use during pregnancy, premature delivery, low birth weights. But all of that is theoretical right now. There's no definitive answer. However, research doesn't back up the idea that eating too much sugar or watching too much TV, things like that, has any significance to causing ADHD. Now, let's look at how it affects the brain. As we know, the brain is comprised of several different areas: the temporal lobe, the occipital lobe, the parietal lobe, and the frontal lobe. ADHD is mostly concerned with the frontal lobe. The frontal lobe is where our brain handles like executive functions, things like that, such as problem solving, memory, language, motivation, judgment, impulse control, social behavior, planning, decision making, attention, and ability to delay gratification. Now this one is, these down here at the bottom are a pretty big deal. Researchers have identified several major networks that work differently in people with ADHD. Reward centers, focus, planning, attention, shifting between tasks, and movement. Now, a patient with ADHD will also often move their feet or have other kinds of tics that display their inability to sit still. But one of the primary ones that I notice as a person who has ADHD is the shifting between tasks is a huge deal for a person with ADHD. Um, what will happen is they will concentrate on a specific task, and if anything distracts them from that task, it's hard for them to move to this other task, take care of that, and then return to the task they were previously working on. Which means what will often happen is they will concentrate specifically on the task they have in front of them without doing anything else, or if there's lots of tasks in front of them, often what can happen is a thing called ADHD paralysis. There's research whether or not that's a real thing, but what happens is because they don't want anything to interfere with this task that they have coming up, often they can't delegate additional tasks to make more use of their time before, like, say they have a delivery coming at 4 or 5 o'clock in the afternoon. They can't do anything throughout the day because they have to concentrate on that delivery, and if they do something else, they might forget. But let's look at exactly how ADHD is kind of what happens in the brain. ADHD is associated with a deficiency of dopamine and norepinephrine, which are two neurotransmitters within the brain. Dopamine is responsible for the feeling of pleasure and reward, and norepinephrine regulates like attention, focus, performing tasks, memory storage, things like that. What will happen in the brain of an ADHD child is they're always seeking that dopamine kind of fix, if you will. What that means is sometimes people think that when they procrastinate or they wait to the last minute to get something done, that's because they are doing just that, procrastinating. But what will happen is when you let something get to that last, second right before it's due, you get that dopamine fix, which allows you to actually concentrate on the task at hand and get something done. Norepinephrine is a hormone that is produced in the adrenal glands. It plays a role in the sleep-wake cycle as well, which is another problem with ADHD students, is that they often struggle with sleeping, and when they go to bed, one of the things that I've noticed when I try to go to bed is it's like your brain is loud. So when you try to lay down and go to sleep, that's when your brain kicks into overdrive and starts thinking about other things. How is ADHD diagnosed? So, according to the DSM-5, a ADHD child must exhibit 5 or more symptoms of inattention and or greater than 5 symptoms of hyperactivity. Impulsivity must have persisted for more than 6 months to a degree that is inconsistent with the development level and negatively impacts their academic or occupational activities. These symptoms include hyperactivity, impulsivity, regulating their mood, and organizational skills. Additional disorders that are kind of associated with patients of ADHD are other behavioral disorders and depression. Often, if you have ADHD, you'll probably exhibit symptoms of depression as well. ADHD significantly affects children more than it does adults. However, as I said earlier, that is starting to change as better diagnostic techniques for adults are starting to be developed. The estimated number of children from the ages of 3 to 17 that have been diagnosed with ADHD is 6 million, which is about 9.8% of the population. As you can see, about 2% of those diagnosed are 3 to 5, 6 to 11, about 10%, and 12 to 17 is probably the time period in which most children end up getting diagnosed. Boys are more likely to be diagnosed with ADHD than girls by about double the amount. About 13% of boys and about 6% of girls. Um, African Americans and whites are more likely to be diagnosed with ADHD as well, as opposed to Hispanic children or at 8% and Asians at about 3%. This chart kind of shows uh, the diagnostic levels over time. As you can see, it's kind of increased over time, and in current times, this is about where it stayed. It hasn't really increased that much. However, adults are being diagnosed more often in recent times. About a 26% increase um, of children and about 123% increase among adults, which means adults are being diagnosed with it at a much higher level um, currently than in the past. And like I said, I think that has a lot to do with understanding the disease a little bit more and knowing what to look for, and um, adults kind of recognizing that some of their symptoms may be related to that, and so they're more likely to go get diagnosed. Now, the treatment for ADHD is often two-pronged. Standard treatments for ADHD include medications, behavior therapy, counseling, and education services. The education services, in my opinion, is one of the most important parts of educating people about ADHD, as a teacher can have a significant impact on the learning ability of a child just by kind of understanding the disease and understanding that sometimes the child isn't necessarily being lazy so much as their ADHD symptoms are manifesting in a way that makes it more difficult for them to learn effectively. And so if teachers can kind of understand what the disease is and adjust their teaching criteria or their methods, it can often help a child with ADHD. Now, all of these treatments can relieve the symptoms of ADHD, but they do not cure it. Let's look at the behavioral treatments for ADHD. Behavior therapy is very valuable for ADHD patients. As I said earlier, it's more of a behavioral disorder, more so than an actual brain disorder. It's the behaviors associated with what's going on in the brain that causes the problems, not necessarily the functions of the brain. What that means is if I'm unable to sit still and learn, that is what is affecting my ability to be successful in school, not because I don't have the proper amount of dopamine in my brain. That is causing the behavior that is affecting my ability to learn. Social skills training. A lot of ADHD children have a hard time recognizing the social cues of other students, and so this can help them kind of understand and recognize how their behaviors or how the behaviors of other people are kind of affecting things. And then parenting skills training. I think this is a really big deal. Often parents believe that their child is just not paying attention or overactive, but when parents kind of understand the symptoms and how to deal with the symptoms rather than punishment, maybe just like one of the things that I used to deal with as a child is they would give me a huge like list of homework, and when I would look at this list of homework, it seemed so overwhelming that I couldn't even get started. So one of the things that my mom started doing is she'd take a piece of paper and cover up all but one of the assignments. And so in my brain, I looked at that and I only had one assignment. And so I could tackle that one assignment. And then once I was finished with that, she would give me another one. So it was a singular task to prevent me from getting quite so overwhelmed with all of the other tasks that I had to do as well. Psychotherapy. Often ADHD children don't recognize what behavior is problematic, and also it can kind of cause emotional problems with the way people react to their symptoms. And so psychotherapy is a good way for children to kind of talk with a therapist and understand their disease a little bit better, and the therapist can help them develop tools and strategies to kind of cope with their symptoms. Now, when it comes to medication, the types of medications that are used to treat ADHD symptoms are often stimulants, and I've noticed a lot of people find that kind of oxymoronic, that a stimulant or counterproductive or counterintuitive, that a stimulant would help somebody that is already hyperactive. However, the way that stimulants work in the brain is they release additional levels of dopamine into the brain. By releasing these additional levels of dopamine into the brain, it can actually relieve many of the symptoms caused by the absence of it, such as allowing them to concentrate easier. It reduces some of the symptoms of impulsivity, things like that. If we look at the brand names or the actual drugs themselves, there are amphetamines, including Dexedrine, Adderall, and drugs similar to that. And then there's the methylphenidates, which is things like Ritalin, Concerta, things like that. There are other drugs that have been somewhat effective, but these are the primary medications to treat ADHD. Unfortunately, they do come with some fairly serious side effects depending on the individual. You can experience heart problems because stimulants increase the blood pressure and the heart rate. Psychiatric problems, stimulant medication rarely increase the risk for agitation or psychotic manic symptoms. Also, because they're stimulants, loss of appetite and difficulty sleeping are also problems as well. So, in conclusion, we have gone over that ADHD affects millions of Americans. It is an attention disorder. A lot of people think that means that there's an inability to pay attention, but really there's hypo and hyper attention issues as well. Some children can become hyper focused on things as well. So it's an attention disorder, not an inattentive attention disorder. It can significantly affect learning in children and work performance in adults. It is a behavioral disorder, and so the behavioral treatment is important. We're treating the behavioral symptoms as opposed to the actual disorder. Medication is valuable to treat the symptoms. It affects children significantly more often than adults, though again, that thinking may change as more adults are being diagnosed. And it is characterized by a deficit of dopamine in the brain and also a deficit of norepinephrine. It affects the frontal lobe, and many symptoms are related to the executive functions of this part of the brain. Thank you for listening to my presentation, and I hope I was able to teach you something. Thank you.